So I wanted to get on here and talk about Luigi Mangione and Brian Thompson and the just United Healthcare, but not just them. So I'm a provider, mental health and behavioral health, and the agency is that I have. We bill the major insurance companies both through Medicaid and private insurance, right through both of those options, and it's a full time job fighting them for to get paid for rendered services. The insurance companies have built in delayed tactics. That's an absolute fact. And I could tell you, it's not just United, it's Horizon, it's WellCare, and it's Medicaid built within there. So the the way these things work is you make a big enough stink as a provider agency, you fight and you advocate for your clients. Eventually you get somewhere, or they retaliate against you, right? And what you got to figure out is whether or not you want to take that risk, or if you want to go out on a limb and take out hundreds of thousands of dollars worth of credit to be able to just float payroll. And it's not really the way it should work in fee for service, right? In fee for service, the whole reason that that even exists right now is because the insurance companies, they have the money, it's sitting in their bank account. Because, for example, for Medicaid, they front load the money. The money's there already. It sits in the bank account of the big insurance companies. When they cover Medicaid, they're referred to as the MCO, managed care organization. So they have the money, whatever that millions and millions of dollars is put aside. So when we take on those clients, we bill, but we're supposed to wait for our money for extended periods of time. And the language within the contracts that in my state, New Jersey, have allows them to pay these claims, or I shouldn't say pay. The language in the contract says process claims within a certain amount of time. So it says something like 97% of clean submitted electronic claims within, I think, 21 days. So that means the other 3% have to be paid within 30 days. And if it's paid over that, they pay, interest on top, which is pennies on the dollar. So when that happens, the key word in there is the claims have to be processed. So the delay tactic that they use to hurt us, not necessarily to hurt us on purpose, they're doing it because they just want to hold on to their money as long as they possibly can, and then eventually delay the claim, is they'll deny the claim, and the language in the contract allows them that once that claim is denied and it gets reprocessed, or if it's being worked on the back end, there's no deadline fixed in the language of the contract. The insurance companies just have better actuaries and attorneys. So that language allows these insurance companies to deny a claim, kick it back to provider agencies like us, who have already paid our providers however many payrolls. If we're going 21 days or 30 days without getting paid, that could be 3 payrolls, right? Or 2 payrolls based on, what they're doing and how long it takes. That means we eventually run out of funds because they constantly delay paying us. We have to request them to look into it. Here's where it gets fun for them. They now no longer have a deadline that they're required to follow to process those claims. Forget pay the claims, because the contracts do not have language in them that require them to pay the provider. So they could pay us whenever they want, right? So if processing takes them 3 weeks, however long it takes them to get that payment out of their account into their, subsidiary account and then into our account is however long it takes, right? That could be 6 months for all they care. So that process alone has put so many companies out of business, or has caused them to just close their doors to working with them. So what that does is it reduces access to care for clients, for patients. So when you want to go and get services, whether it's mental health for yourself, your family, your child, and there's long wait lists, the reason is because providers do not want to work with these insurance companies. So they reduce access to care. That's a direct violation of the Affordable Care Act. And I've reached out to my local senators, Congress people, and they all say the same thing. Locally, senators will tell me, oh, that sounds like a federal issue. Federally, I'll reach out to my congresswoman, and she'll tell me, oh, that sounds like a state issue. They don't want to touch it because who lines their pocket gets them elected. It just goes around and around and around. And these may sound like wild accusations, but I see it firsthand, right? And at the end of the day, the contracts are written how they're written to benefit only one entity, big insurance. The client never, ever, ever gets the benefit in this equation whatsoever. My agency happens to do very strong advocacy for the clients, so we work pretty well with the insurance companies and Medicaid to get both us paid, but also to make sure the clients are getting services. But what happens is once they do that, we ask them, can you implement this as a global fix for the entire system of care? This will be a post for another day or a conversation for another day, but I'll have you know that any insurance company that's ever done a fix for my agency has never implemented that fix for the state. For any other agency, they've never implemented as a full fix. So they keep it within the system of care to keep it broken. So to keep that delay tactic or that underspending tactic within there. And they know it exists because we've discovered it with them, assuming they didn't know it existed beforehand, right? So that could be a conversation for another day, but it just baffles my mind to see it from both ends. Obviously, as a client myself, of insurance companies, right, as a member, but also as a provider, and trying to advocate both to get paid for rendered services, but also to advocate for my clients. To get them services to reduce or the impact of a gap of service. We provide mental health and behavioral health services. A gap of service is a big deal. So something's got to be done. The state is too slow to act. Maybe not on purpose. Maybe it is on purpose. But I know that they're significantly, the people that they have in place are overworked and underpaid. Right, they'll have one person doing everything, and so on. But listen, man, it's food for thought. Take it for what you want. Happy to talk about it more, and I'll probably post more as more thoughts come to my mind. But I'm excited that these things are coming to the surface because my team and an advocacy group I'm part of have been bringing this to light and mailing white letters to God knows how many entities for the last 4 years. And ProPublica posted an article that looks like they lifted almost exactly what we've been writing about and to the state almost verbatim. So, and they didn't obviously, but it goes to show you these issues exist, and it's not going away unless somebody does something, right? So, take it for what it's worth, right? That's what I got for you.